According to the Centers for Disease Control and Prevention, nearly 200 measles cases have been confirmed in the United States so far this year. 9 states have reported infections, including Ohio, North and South Carolina, and Florida. But how is this possible? In 2000, the CDC declared measles eliminated in the U.S. In today's cover story, Matt Stone looks at why the disease is making a resurgence and what can be done about it.
Once we start to see the spread of this virus, it's going to be very difficult to eliminate it.
That's Dr. Therese Linnen from Akron Children's. She says falling vaccination rates are leading to cases of measles, a virus which was once thought to be eliminated in the U.S.
Measles is an extremely contagious disease. It spreads so easily that if that vaccination rate or the immunity within our population drops below 95%, then we are going to see an outbreak of measles.
In Ohio, for example, CDC data showed 88% vaccination coverage among kindergartners last year, well below the needed 95% for continued herd immunity. Measles has been around for hundreds of years, with a vaccine created in 1963.
Every child got measles at some point in time during their childhood. And again, 1 out of every 1,000 of those children would die. And 1 out of every 20 of those children would get pneumonia. That just tells you how bad measles can be if you just let it go on its own.
According to the National Foundation for Infectious Diseases, about 1 in 5 unvaccinated people in the U.S. who get measles will be hospitalized. 1 out of every 1,000 people with measles will develop encephalitis, which is a swelling of the brain, and that often leads to permanent brain damage.
Measles starts with a rash that starts in the forehead and then just sort of distributes down the face and onto the body. Along with that, classically, we see cough and we see pink eye.
You then get high fevers, pneumonia. It can even lead to death. The biggest problem is how easy it is to spread.
When you cough and sniffle, it actually gets into these small little droplets that hang in the air for up to 2 hours. And so you can actually infect people who walk into the same room that you were in 2 hours before, and they can get infected by showing up and just breathing the air that you coughed in 2 hours ago.
Many parents started to skip vaccinations after COVID hit. Now doctors say we're seeing the consequences of that. Plus, there are millions of immigrants coming into the country who are unvaccinated. The CDC hopes more people start getting the MMR vaccine, which they say has been recommended and has been tested safe for use since the 1960s. With today's cover story, I'm Matt Stone.